when you are performing a calibration, when you're performing blood flow restriction training, the cuff always goes at the most proximal portion of the limb. When I'm applying upper body BFR, the cuff always goes at the most proximal portion of the arm. Even if I'm rehabbing the elbow or the wrist, the cuff goes to the most proximal, the highest point on the arm as possible, just under that deltoid. For the lower body, when I'm applying lower body BFR, the cuff always goes at the most proximal portion of the leg. It'll be just under the glute at the most proximal portion of the leg, right? The top of that leg. Even if I'm working the knee, the ankle, the foot, I still put the cuff at the highest point of the limb as possible, as close to the trunk as possible. Upper body BFR, see it used most often. Everything, thinking like pecs, lats, and above that, okay? Phenomenal. Upper body BFR does a wonderful job of addressing neck and trap pain, shoulder pain, okay? Wrist, elbow, pec, lat, rhomboids, traps, great. Lower body BFR, obviously everything associated with the leg, but then also effective for the glutes, the hips, the lower back, the abdominals. If you're doing core work, adding lower body BFR to your core work will make it incredibly challenging. It will just amp up that intensity without the application, without adding additional external loads. Hopefully that helps. Again, whenever you're calibrating blood flow restriction or applying blood flow restriction, it always goes at the top of the arm or the leg. You can do both arms or both the legs, but never doing arms or legs together, okay? And when you calibrate the upper body, we're seated nice and tall, arms at heart height, nice and relaxed. And when you calibrate lower body, we're lying supine, nice and relaxed. Thank you. God bless. Have a great day.